it has definitely been the busiest year and the most unusual year of my 25 years of being a GP. Um, my role has been really varied and interesting. Last year, I was doing a lot of frontline seeing patients with COVID symptoms. That big change from face-to-face consultations to telephone and video consultations. And then as we've gone through, I'm now doing a lot more work on the vaccination programme, which is obviously really busy. So my role has been sort of coordinating our Liverpool response, and all of the GPs who've been working together. I've been sort of holding that coordinating role.
Well, listen, we put on Instagram yesterday a little bit of a punt to get some questions. So we got loads of questions for you from our audience, which we'll come to shortly. Before we do that, just tell us where we are right now as a city with infection rates.
So our infection rates are coming down. They are much better than they were sort of in January, but they are still high. And this is the problem, we've all become a little bit immune to the numbers and a little bit relaxed about hearing them. But they are still up in the hundreds. And if you remember back in the summer, we got really worried about figures that were creeping up to 70 or 80 per 100,000. So they are still at a level where we all need to be alert and not think that we can relax the social distancing rules. And we still have a lot of people in hospital in the city, more than we did during the first wave. And more people in ITU. So our hospital colleagues are still working flat out. This hasn't gone away yet, unfortunately.
What's it like, Fiona, on a COVID ward, somewhere like the Royal, for instance? What are those staff going through? What are the patients going through? Just kind of paint a picture for us.
So when you hear speaking to colleagues who are working there, the things that they talk about are the relentlessness of it. It's every day that they are they're full. They're used to working hard, but they are stretched further. So if you take an ITU nurse, for example, normally that ITU nurse would spend their day looking after one patient. Now they're stretched out 2, 3, 4. They're supervising colleagues who normally work somewhere else in the hospital but have been drafted in to support them in intensive care. So they're supervising other colleagues. So every day is pressured for them. But the thing that they get, I think, most distressed by is watching people dying of COVID alone without their families. Those conversations that the staff have to have with people's families over the phone is what's really bringing them down and really affecting their morale. And we talk a lot about the staff working in ITU, but the staff working on the ordinary wards are working under incredible pressure as well. Imagine you're working on a ward where the people you're looking after have been deemed not suitable for intensive care because they're too ill or they're too frail. That's a really tough shift to put in. So it's really affecting their morale.
There's a lot of talk at the moment. I mean, there's a great campaign which we spoke about last week on the guide, and it's all about supporting NHS staff once this is over, because people are saying that there's going to be a landslide of mental health problems, for instance, for those heroes of ours that are working so hard.
Yeah, I think that's true. I think we need to think about supporting them now, and the way that everyone supports them now is by following the rules and staying at home and keeping the infection rates down. That is what they desperately want us all to do. And then in the long term, I think that there is a conversation to be had about how we look after them long term. The NHS was already struggling with low staff numbers and lots of vacancies. The last thing we can cope with is lots of staff leaving. And even when COVID finishes and all those pressures finished, these staff all know that there is a big, long waiting list of people who've had their treatment for other things delayed. And they know when they will want to crack on and get that done. But we need to think about what realistically we can ask of them going forward.
Let's just touch on that, because there's been a lot of talk about people who've missed treatments for
Yeah.
cancer, maybe missed screenings, maybe just missed routine operations on a broken leg, or something like that.
Yeah.
What will happen now? Because that's obviously the big worry. Because beds are full, we can't get those patients in. What is the kind of challenge ahead to look after everybody else?
So there's a couple of challenges. In the here and now, I can reassure people that if you find yourself in an emergency situation, if you think you're having a heart attack or a stroke, you should still ring 999. You should still go to A&E, because the NHS is still open and is still dealing with all of those emergency cases, as it always has done. And if you need an emergency operation, for example, that will still be done. And they've put in lots of measures to keep as separate as possible. They have COVID areas in the hospital and they have non-COVID areas. Anybody who needs an urgent cancer operation, there is a brilliant system in place with all of the hospitals across Cheshire and Merseyside coming together to look at the list of people who need a cancer operation in the next 4 weeks, and saying, right, collectively, mutual aid, how do we support each other to make sure that this patient gets their operation? And that is working, and those delays are minimal. Where there is big, long delays is for things like hip and knee replacements, cataract operations, ENT procedures, things that are important but not life or limb threatening if they're not treated. And that's where the waiting lists are going to go up, or going up already. And so there is a lot of work happening to look at those waiting lists, and again think, how do we work collectively as a system to make sure the right people get put to the front of that queue? How do we look at the people who've waited the longest and make sure that they are given some priority? So it's very complicated, and it's a big challenge, because a lot of our colleagues, like I said, have been redeployed elsewhere. And we do know that people who need a hip replacement, it can be life-changing. It can be the difference from being able to go out for a walk and not. So we know it's important. So we are going to do our best to tackle that.
Okay. A lot of people talking at the minute about this light at the end of the tunnel, and it does feel like we are moving into a much better place right now, Fiona, in terms of the vaccination process.
Mm-hmm.
You know, there's news this week about new treatments, research for new treatments within the UK. Are things looking better? Are things looking more positive?
Definitely, we can be positive. The vaccination programme is going, I think, well, better than I expected it to. Excuse me. We have, as you say, got new treatments. Survival rates for COVID are improving. And the numbers are coming down because people have really stuck to the rules and have really knuckled down and followed lockdown. So yeah, we can definitely be optimistic. What we mustn't do is translate that optimism into a lack of attention and just falling back. If we go back to the way that we were too quickly, if we open everything up too quickly, we will very quickly bounce back to where we've been in January. But yes, we can be optimistic.
It's good news. It's good to hear. We got some questions from our audience. We'll come to shortly. Just first of all, you've been heavily involved in the vaccination process. St Helens Rugby Club is one of those venues, yep, which is mass vaccinating. So many more across Merseyside. It's going well, isn't it? And just tell us about that process and how it's working and what's next in the vaccination process.
So yeah, it is going really well. So my role has been focused within Liverpool. And as of yesterday in Liverpool, we had done over 111,000 vaccines in the last 10 weeks. And, we've vaccinated 90% of our over 80s now. So I am so impressed and delighted with how that's gone. I can't impress that enough. The way that our system has come together. So we have hospital hubs who are vaccinating. We have our GP and primary care network sites. We have 14 of them across the city now. And they are working so well together. We have 3 pharmacy sites in the city as well. and they're all working really well together. They're all sitting there saying, give us more vaccine because we can do more. So I'm really optimistic about how that's going to go. I suppose having so many sites has created a bit of confusion for the public, I think, about how do you get your vaccine, and some people get a text message and other people get a letter, and some of that has been out of our control, and we are doing our best to try and make that a little bit clearer. I'm feeling a bit more positive because one of the main reasons there's been confusion has been the supply of vaccine. So our primary care network sites have often only been given 24 hours notice of a delivery, and sometimes only a couple of days. And with the Pfizer vaccine, once it arrives in the practice site, they only have 3.5 days in which before it goes out of date. So it's a bit of a mad rush just to get people in to fill those slots. But what we've had this week is a 2-week schedule of when these vaccines are arriving. So this is hugely positive for us because we can now do a bit more planning and give people a bit more notice about how to book their appointment. So you will start to see more information coming out about how to book your vaccine. And we hit the target that the government set of the 15th of February for the top 4 cohorts. And this week we've started on cohort 5 and cohort 6. So everyone who's aged 16 to 65 who have a long-term health condition is now getting invited, and everybody over the age of 65. And that group is broadly, if every year you're called for your flu vaccine, then the chances are you're going to be in this group. But we are still saying to people, please don't phone your GP practice. The way that this campaign's being run is different to the flu campaign, where with flu you do ring your own practice and it's your own practice nurse quite often that gives you your vaccination. With this campaign, it's groups of practices working together, and they've set up systems where they will contact you. If you are in one of those groups, we expect that we'll be able to vaccinate you by the middle to the end of April, but we can't do everybody next week. So we do need people to be a little bit patient. If you're in those groups, your name will be on our list and we will be calling you. I'm confident we got through the cohorts 1 to 4 better than I expected. We're even more efficient now, so I'm confident that we'll get through the next 2 cohorts as well.
Do you know what? It's been funny the past couple of weeks, Fiona, because I've spoke to so many people, and my own mum and dad included, whose parents have been having rows because one of them's got the vaccine letter and the other one hasn't. But it seems to be balancing out now, doesn't it, in terms of that kind of 60 to 70 category?
Yeah, definitely. The older population we've vaccinated 90% of them. The exception to the rule about don't ring your GP practices, if you are over 70 and you have heard nothing, then you can contact your GP practice because you should have heard something by now. So if you're over 70, and you've not heard at all, then do give your GP a ring.
Okay, perfect. That's sounding good. We've got some questions. So these were put out on Instagram yesterday. First off, Anna Fletcher has asked, will we ever get rid of COVID-19 altogether?
Oh, I wish I could give you a straight yes, definitely answer, but I suspect the answer is probably not. And it's probably going to become something that we learn to live with in the same way as we live with flu every year. So I fully expect that in future years, when in our practice we run our flu vaccine campaigns, that we will be doing COVID vaccines at the same time. But I think the success of the flu campaigns and how we've learnt to live with flu gives me some optimism that even though it won't go away completely, we will learn to have it in our lives, our normal lives, without it controlling our lives. Don't ask me when that'll be.
That was going to be the next question.
Yeah.
A big question everyone's keen to know. This is from Dave. What do we know about the new variants? And are they in Liverpool? We've heard that they are. Then they've kind of disappeared a little bit. I know you're a GP and you're not a scientist researching these new variants, but what do you know, Fiona?
So we know that all viruses mutate. So this isn't something like sci-fi or new or different, and people shouldn't be unduly concerned. The scientists who have been studying this have been waiting and expecting this. That's why they were looking for it. So when you go and have your PCR samples done, since the very beginning of the pandemic, a selection of them have always been tested for their genomic sequence so that we can see how the virus is changing. So it's not necessarily a cause for alarm, it's a cause for concern, because we know that some of the new variants seem to be more transmissible. So in other words, it's easier to pass it on to other people. At one point we were hearing they're more transmissible but not more deadly. And viruses will often do that, that their aim is to survive. And if they kill off everybody, then they kill off themselves as well. So they will evolve to support their own survival. But the fact that we know about them and that we're tracking them and following them and following it up and learning all the time means that it's actually quite a simple process for us to adapt our vaccinations to act against these variants. So it's the same message that we give for whatever the variant is. It's the whole hands, face, space thing. You're less likely to contract it and pass it on if you keep your distance, wash your hands, wear your mask, etc.
Am I right in thinking, Fiona, that as time progresses, new research into vaccinations, into treatments, so much has happened within 12 months. The next 12 months could be even better in terms of that research, couldn't it?
Yeah, it will be better, because one of the most incredible things to watch as a medic and a scientist over the last 12 months has been the rate of research. And so that alarms a lot of people. There's that concern going around that the vaccines haven't been properly tested because they've been developed so quickly. What we've seen in the last 12 months is organisations that normally compete against each other and keep their secrets from each other have collaborated and shared. And so that's why we've had the vaccine so quickly. Normally it takes months and months to get the funding for a trial, and then it takes months and months for to get enough people to participate and volunteer for the trial. This time the money was there straight away. They had more people than they could cope with volunteering for the trials, and so I think we'll see more and more of that happening. And so, yeah, who knows where we'll be this time next year, because we certainly didn't think we would be right here this time last year, did we?
Great way to look at it. I've just got two more very quick questions. Peter has asked, what is the latest with international travel? Can I go on my holidays this summer?
So I don't have a crystal ball, and I don't have the ear of the ministers in Downing Street to know what they're going to say. I can only tell you what my interpretation is, and I am not, or I have told myself that I am not going on holiday abroad this year. Yesterday I have booked, fingers crossed, to go to Scotland for my summer holidays, and I think that's what we should all be thinking, really, to avoid disappointment.
Let's hope you get the weather in Scotland.
Let's hope so.
Fiona.
Yeah.
Kirsty has asked, both parents are now vaccinated. I live alone with my daughter. We've avoided any contact. Can I now form a bubble and possibly stay over at their house? It's a good question, because
it's a really good question, and loads of people will be wondering this. And I think on an individual basis, people will be sitting there working it through in their minds and thinking, it must be safer for me to do this now. But at the moment, the advice needs to remain the same, that even if you've been vaccinated, you still need to do the social distancing, the hand washing, etc., and keep away from vulnerable members of your family. I do think that advice is going to change soon. But again, I haven't got that in writing from anywhere. But at the moment, the rules are still the same around bubbles and family mixing, because we know, sadly, that the vast majority of transmissions cases pass actually within people's family homes. So it's just not worth it, not just yet.
But fingers crossed, coming weeks, coming months, that will change.
Mm-hmm.
We're still in a pretty dark place in terms of hospital admissions and infection rates here in Liverpool, but there does seem to be a lot more positivity, Fiona. So thank you so much for telling us about some of that. Just what's your final message to anyone watching right now who's young, old, had COVID, not had COVID? What would you say to the population of Liverpool?
I would probably say stick at it. Haven't we done an amazing job, all of us working together to get us to the point where we do now have light at the end of the tunnel, and we've got a fantastic vaccination programme rolling out. Spring is coming, we'll be able to go outside. So stay positive, look after yourselves, stick to the rules for just a little bit longer, don't throw it all away now.
Okay, listen, let's catch up again in a few weeks' time.
Yeah,
Dr.
lovely.
Fiona Lemmens, thank you so
Thanks.
much.
Thank you, Jay. Bye.